Before we leave all of this, I know there's a difference in the way people are covered, the way things are paid, inpatient versus outpatient, formulary in-house versus pharmacy costs outside. What does this mean to the total health care bill, and what does this mean to patients?
Well, it depends on the funding source. So if you're a Medicare beneficiary, you pay more typically on outpatient coding, just because of the way that traditional Medicare is structured. Under a Medicare Advantage plan, that's not necessarily the case. But yes, it could be a difference to you in terms of where you are in your deductible and so forth, whether it's an outpatient versus
right.
an
I mean,
inpatient
I guess
code.
what I'm asking is, I'm Joe Ulcer or Jane Ulcer, and I can go and get outpatient therapy and go to my pharmacy and get a prescription, get that filled with some sort of deductible, or I can get admitted and have the bill covered by my insurance in a different way. What turns out to cost more for the insuree? Do we know? Does anybody know? Really, on average?
The lack of coordination of care at the outpatient level, because in many instances, a lot of care in wound care is redundant. They'll get redundant orders for supplies. They'll get redundant care. They'll see specialists who will focus on radical debridement of a wound, and then later on they'll see another specialist who focuses on exudate management for a wound. There are attendant supply costs for both of them. The surgical intervention has an entirely different set of supplies and management from an exudate potential. Excuse me. And then when we look at how does home health do that? Well, that's predicated entirely on the expertise of the ordering physician. Is that ordering physician a wound care specialist? More often than not, they aren't. They're a gatekeeper in a risk environment, okay, who is not a specialist in wound, who is focusing on the comorbidity and not so much on the actual treatment of the wound. Right. So these are cost drivers. I don't want to leave this topic without explicitly mentioning something that you brought up, and I didn't really focus our viewers on at the time, but I haven't forgotten. At the end of the day, whether it's sepsis or a non-healing wound or purulence or everything else, a lot of these patients are looking down the barrel of an amputation because that's the end of the care line.
Diabetic patient. Correct.
Right. And do the patients understand that? And do the primary care physicians understand that? And do the people in the EDs understand that if you do this wrong, and of course sometimes if you do it right, that's where we're headed?
The answer is it depends.
Thanks a lot.
Yeah. It depends on several factors. Number one, first and foremost, the protoplasm of the patient, the underlying comorbidity of that patient. As far as educating them to the risk of amputation, that's something that we have to do really on the front end. Because unfortunately, even someone who comes in with a relatively new wound problem, who's diabetic, who has a hemoglobin A1C of 9, as an example, or has peripheral arterial disease, I think that wound can escalate very rapidly to something extraordinarily devastating for that individual.
I've seen patients come in who know they have diabetes, and they've come in very early with a very small lesion, and they go, boy, this scares me, because I'm worried what's going to happen. And I've seen people come in extremis. I'm not worried at all. Give me some antibiotics. It's all going to go away. So to some degree, is that because we're training them wrong or because they're hearing it wrong?
I mean, there are personality differences as well. There are people who are very proactive and who have families that are very proactive. They have a very strong support system, which is extraordinarily important. And then you have individuals that don't have that expertise, that may not be well educated in general. They may not have a good support system. They're living by themselves. They're elderly, as an example. And they certainly are at much greater risk and much more difficult to manage ultimately.